The referral process from a GP's point of view firstly involves writing a letter which is usually addressed to the Carrington Road Turning Point Eastern Treatment Services, and the patient will then be contacted to offer an appointment to be assessed. The GP can also be expected to be contacted by a clinician just to clarify issues around diagnoses and drug management.
When a client's had their assessment at Carrington Road, it is brought into a clinical review meeting where the team discusses the best plan for the client for their detox. We also prioritise clients that may be at high risk or medium risk.
At that meeting, we then develop the individualised care plan that is their map and their journey through the process of care that we give them. And that can also include a care plan for One East or Wellington House or both.
One East is set up predominantly as a detox unit. It has the safety net of the hospital behind it, and that is beneficial from a medical perspective as well as behavioural.
First and foremost, they're in a safe environment that is staffed by experienced nurses. We've got the on-call doctors 24/7.
My role here is to support our Aboriginal and Torres Strait Islander clients from beginning to end. So there's more consistency of care and trying to really encourage the people like our psychologists, our nursing staff to really take on someone's culture as part of their recovery.
Clinicians at the start or at the contact point need to alert clients to the fact that addiction is a multifaceted problem, and also reassuring clients that, look, this is a journey, it's not a destination. Each individual client has got their own unique experiences, and the tools that are to be presented should actually match what the client needs.
The tree's incredible, and it embodies strength and hope and transition, and it allows people to be able to write messages of strength and encouragement to other people who potentially may be struggling and really need that.
So there are effectively three types of detoxes that we do. We provide symptomatic relief for patients undergoing detox from a wide range of drugs. We also provide detox from opioids. And then the third group of detoxes we do are detoxes from hypnosedatives, including alcohol. The other processes that include the provision of nursing care and emotional, psychological, social support.
We have no smoking whatsoever from the moment they're admitted. We're willing to administer as many nicotine replacement therapy products as required to help in that process.
It is our intention and our practice to detox patients off all medication and drugs.
At Wellington House, we have a program called DBT, that's dialectical behavioural therapy. We do a skill set on that. That works around mindfulness, distress tolerance, emotion regulation, and interpersonal skills. And that just really helps the clients put in some boundaries and establish areas that they'd like to work on.
We have different activities every day. We get up in the morning, we have a morning meeting.
We do some art therapy, just some creative groups. There's also physical activities like yoga, Pilates, and some personal training as well throughout the week.
They can stay up to 10 days at One East, depending on their detox requirements. And if they then require it and it's deemed as potentially beneficial, they will be transferred for stabilisation to Wellington House for up to another 18 days. From there, services are implemented to transfer them to correlating services that can support their recovery journey further.
Post-discharge, we've got also our peer workers who will follow up with them post-discharge just to touch base to make sure that things are still traveling well, and where there's a need for them to re-engage with the service again, then we'll make an arrangement for them to come back to the service through our normal referral or walk-in service.